I'll be back. Couldn't actually get into the restaurant.
Hey, how you doing? Doing well? Good to see you. You're the soon-to-be significant other. Got you. Nice to meet you. I've got it.
We're doing it back. Good morning, everybody, and welcome to the Health Sciences Centre annual commencement exercises. My name is Mark Platt. I have the pleasure to be the Assistant Dean for Student Affairs, the School of Medicine, and your MC for the morning. At this point, before we begin formally, please ask you to silence your cell phones and remind you that although we're all dressed like characters from a British movie, we encourage you to joyously take part in our ceremony today by cheering, clapping, and making suitable noises as we graduate our students. At this point, we will begin formally, and I will ask you to stand for the national anthem, which will be, please remain standing for the invocation, which will be given by the Most Reverend Michael Duca, Bishop of the Catholic Diocese of Shreveport.
Let us pray. O divine physician, we gather today in a spirit of celebration as we honor these graduates at the completion of their studies. We give you thanks for the blessings of this medical school, who prepared these new doctors and medical professionals who will serve us when we are in need of healing and care, or in the research that will advance the care we receive. May these new doctors never cease to be filled with wonder and awe of human life and the working of the human body. Fill them with a respect for their patients, using all their skills for their benefit. For those in research, give them an enduring dedication, patience, and a desire to work for the good of all mankind. Give these graduates humility to seek help when needed, and the courage and confidence required when they must act in a difficult situation. Guide our proceedings today with a spirit of dignity, respect, and joy. We pray this in your name, who is love and the source of life. Amen.
At this time, it's my pleasure to introduce Dr. Gali, Chancellor of the Health Sciences Center in Shreveport and Dean of the School of Medicine.
Thank you, Dr. Platt. I'd like to welcome everyone here on this beautiful, sunny Saturday in Shreveport, Louisiana. Graduates, guests, faculty, and staff, family, alumni, and friends. It is certainly my great pleasure to welcome you to the 2016 commencement of the LSU Health Science Center Schools of Medicine, Allied Health Professions, and Graduate Studies. On behalf of all the graduates, I want to thank those who have traveled from far and near to join us here today. Not only do we appreciate your presence at this auspicious ceremony, but also your guidance and support over the careers of these students. Each and every one of you has played an important role in shaping the success of the 188 students who will receive diplomas today. They certainly could not have done it without your help. To the class of 2016, congratulations. There are going to be very few days in our lives that we remember, but I can certainly guarantee that this will be a day that you'll remember. It's a day that I remember myself. You've worked very hard for many years to reach this milestone. You've grown professionally and personally during your time here. You've not only earned degrees, but you've also forged friendships that I can assure you will last a lifetime. We do have some special guests here, members of the School of Medicine's class of 1976, and they marched in with our School of Medicine and Allied Health and Graduate School today. This is their reunion weekend in which they are celebrating the graduation 40 years ago. I would also like to thank, I would also like them to stand right now. This time we have representatives from our Alumni Association is presenting each of them a commemorative medallion. There they are. This class of 41 students was the fourth class to graduate from our Shreveport Medical School. Certainly, I can attest to you, there's at least one or two of them that were teachers of mine. They were really young when they were teaching me. I see Dr. Harper over there. The quality of these physicians and their dedication to medicine reflects well on our school and this faculty. In caring for their patients in the years since graduation, they have helped establish a reputation of our school as an institution that trains outstanding physicians and surgeons. Class of 1976, thank you for being with us today. Like the class of 1976, this class of 2016 has received outstanding training. Whether you're going on to residency, further residency training, or postdoctoral work, or directly into your career, as many of you are from the School of Allied Health, this is really an exciting time to use the skills that you've learned over these past few years. Our faculty members, many of whom are here with you today, some could not be here today, but certainly they've helped prepare you with the knowledge and experience that you need. They have worked diligently to give you a sense of mastery and confidence, thereby preparing you for success. I thank our entire faculty for their ongoing commitment to patient care, education, and research. And so, graduates, today you crossed the finish line, or some may say the start line. You've overcome many challenges to achieve your goals. Enjoy this joyous ceremony and your sense of accomplishment. Also, remember, as I know you will, to personally thank those who helped you along the way. It is now my pleasure to introduce our distinguished guests who are seated on the platform. I have to the right here, Mr. Ray Lassane, Chairman of the Louisiana State Board of Supervisors. Thank you, you're welcome to clap. Ray's been an incredible supporter. You know, Ray's based out of Bossier City, so it's really a treat to have him as the chair of the Board of Supervisors, because he's just been an incredible supporter of our entire Health Science Center, both here and fighting for us in Baton Rouge. Dr. Michelle Au is our commencement speaker. She hails from the Department of Anesthesiology at Emory St. Joseph Hospital in Atlanta. Thank you for being here, Dr. Au. Your MC, Dr. Mark Platt, our Assistant Dean for Student Affairs. Dr. Sandra Rohrig, Dean at School of Graduate Studies and Associate Dean for Research at our School of Medicine. Dr. Joseph McCullough, our Dean of School of Allied Professions. Dr. Dennis Wissing, Associate Dean for Academic Affairs, School of Allied Health Professions. Dr. Jane Eggerstadt, Vice Chancellor for Academic Affairs. One of the most popular people on campus and also Co-Chief Marshal for today's commencement. Another very popular individual, Dr. David Deshay, Professor of Cellular Biology and Anatomy. You've got a lot of family here today, David. And also Co-Chief Marshal. The one man that everybody's got to get through to get to medical school, Dr. F. Scott Kennedy, Assistant Dean for Student Admissions. The president of the Shreveport Medical Society and an alumnus of this School of Medicine, Dr. Russell Van Norman III. Mr. Kevin Flood, Executive Vice President for Development of the LSU Health Sciences Foundation. Dr. Norman Harris, President of the General Faculty and Professor of Physiology. And of course, the Most Reverend Michael Duca, Bishop of the Catholic Diocese of Shreveport. And last but not least, Miss Kim Carmen, our Registrar for the School of Medicine. Thank you, Dr. Platt.
Thank you, Dr. Gully. I now ask for the class president, Ms. Sarah Bandrick Grimes, who will introduce our speaker and say a few words of her own, I believe. Sarah.
Good morning. Leaves will change, roots grow. One without the other? No. Medical school. Yay! I read that haiku that I wrote almost 4 years ago as we sat in the atrium of the medical school for Parents' Day. A little more nervous and a little less refreshed than we are now after our fourth-year school schedule. We talked about how the people in our life make up a sort of tree. Our families and close friends hold us firm in our foundation as roots of our tree. And then different acquaintances and friends come through our lives as leaves that change with the seasons. I look out today across this sea of black robes and I see so many leaves that have become roots. Y'all, we have journeyed together these last 4 years. We have studied hard, we have celebrated hard. We have watched each other fall in love and find spouses. Word on the street is if you pay out-of-state tuition, they will guarantee you a husband by graduation. We have ripped our pants entirely along the way of the seam of our groin in a patient's room during our first history and physical, or so I heard. I also heard that the person that happened to said that the short white coats are very, very short. We've had babies, we've lost parents, we have found best friends, friends that started as leaves and quickly became roots. We skied, we beached, we conquered that interview trail to become doctors, and we did it. Parents, I know that your hearts are just swelling with pride right now. I want you to know that over the last 4 years, I have watched your children become doctors, but I have also watched them become healers. Dr. Donald Berwick said, to become a healer, you must do something more difficult than putting your white coat on. You must take your white coat off. You must recover, embrace, and treasure the memory of your shared, frail humanity, of the dignity in each and every soul. Parents, your children have done that. Thank you for encouraging and cultivating them to be empathetic, respectful, and kind. Today, they become doctors, but more importantly, they have become healers. To Dr. Eggerstedt, Dr. Platt, Ms. Carmen, Ms. Christie, and the rest of the administration, faculty, and staff, bless you. Today, on the outside, you will do this. Congratulations, we're so proud of you. We will miss you so much. But I know deep down inside, there's a part of you that is also feeling this. Yes, 110 more students that will never come complain in my office ever again. In all seriousness, on behalf of the class of 2016, I want to thank you deeply for your fierce dedication to our medical education. We certainly could not have done it without you. Finally, to my classmates, congratulations. It's been an honor to be your president for the last 4 years. I am proud to call you colleagues, but I'm more proud to call you friends. Thank you for being my leaves, some of you turning into deep, deep roots. It wouldn't be a Sarah speech if it didn't end with a haiku, and lucky for y'all, my publisher has not gotten back to me about the book deal, so I'm gonna give you a free one here at the end. 4 full years later, we leave hooded, tassels turned. In my heart, you'll stay. It is my pleasure to introduce our graduation speaker today. Dr. Al is an anesthesiologist at Emory St. Joseph's Hospital in Atlanta, Georgia. Born and raised in New York City, she graduated magna cum laude from Wellesley College in 1999 with a degree in psychobiology and received her medical degree in 2003 from the Columbia University College of Physicians and Surgeons in New York. During her 3rd year of medical school, she started penning the Scut Monkey comics, a series of cartoon strips inspired by the absurdity of the medical education process. In the years since, these comics have been published and presented at medical conferences and journals around the world. Some of her best-known comics include The 12 Types of Medical Students, How to Annoy a Resident, and The 12 Medical Specialty Stereotypes. In 2008, Dr. Al completed her medical residency in anesthesiology at the New York Presbyterian Hospital at Columbia University. During her final year of residency training, she decided that she didn't have enough to do and wrote a medical memoir entitled This Won't Hurt a Bit and Other White Lies, My Education in Medicine and Motherhood, which was published by Grand Central Publishing in 2011. She is currently working on her 2nd book, a hybrid memoir about the history of anesthesiology and the experience of practicing in a field of medicine that no one really seems to understand. Dr. Al lives outside of Atlanta, Georgia with her husband, the oculoplastic surgeon, Joseph Walrath, and her 3 children. Please join me in giving a warm Louisiana welcome to Dr. Michelle Al.
Thank you so much for that intro. I am too short for this podium. I wore flats to be more practical, but thinking I should have worn heels for that reason. Good morning and congratulations to all the graduates of the class of 2016. It is such an honor and pleasure to be with you today to celebrate your achievements. My own medical school commencement seems impossibly long ago, and in the blur of festivities and flurry of transition, it's honestly difficult to remember too many of the details of that ceremony, or anything that followed. But in a commencement ceremony, there's really only two things that are truly important. One important thing, probably the most obvious thing, is the part where they actually give you your diplomas. Behold. Spoiler alert, that comes at the end. Sorry, guys. Believe me when I say that I'm all too aware that one of the few things now between you and your hard-won degrees is me standing at this podium, talking and talking and talking. Don't worry, I get it, and I will try to keep my remarks brief. The second thing about today is the part that tends to get lost in the blur, which is why I want to specifically make note of it up top, so that we can pause and allow the memory to imprint. Graduates, look out into the audience. Look at the faces of the people who have come to share this day with you. Your parents, your families, your friends, your teachers. You are standing up here today, but they are standing right behind you, holding you up with such love and such pride that it positively beams out of them. Remember this. You've earned this moment, but so have they. And man, are they ever proud of you guys. A few months ago, when I sat down to write this address, I got a little bit stuck figuring out how to start, which is a euphemistic way of saying that I had no idea what I was going to talk about. Because in my mind, the occasion of a commencement calls for grand statements. It begs to put words to sweeping concepts and noble ideals. And above all, it asks of us to invoke the sense of a world out there much bigger than any of us. You have all spent your years in school learning about the big things. First, the building blocks of the science at the heart of all that we practice in medicine. Then, the application of those building blocks to the human body, the manifestation of pathology therein, and then ultimately their function in patient care. And then there are the more abstract big things: ethics, communication, compassion. Your training up until and beyond this moment is all about the big things. And don't get me wrong, the big things are important, but you don't need me to talk to you about that, because these are things that schools and training programs are really good at teaching you. What I actually want to talk to you about today is the little things, because it's the little things that largely cannot be taught in the classroom or at the research bench, and you will not see any grand rounds lectures or textbook chapters about the little things. The little things are just that, little, small moments that you will run across in the course of your careers that will stick with you. Peeks and glimpses through the big things that show you that there is something more underneath. I'm going to tell you a story right now to illustrate exactly what I mean. As you may have heard when they introduced me, I'm an anesthesiologist, which for some people means that I'm the physician in charge of safeguarding a patient's critical life functions during, before, and after surgery or medical procedure. What this means for other people, I know you're out there, is that I'm the person who stands at the head of the OR table behind the blue drapes and pushes the button to make the bed go up and down. Oh, that's what she does. I get it. See, what you might not know is there's like 18 buttons on that thing, so it's pretty complicated, guys. You don't know that. It's hard. A few years ago, I did the anesthesia for an emergency case at the hospital. The patient was a man in his mid-40s who just a few days prior had major yet routine surgery on his heart. The night I was on call, he was upstairs in the intensive care unit in the ICU, recovering and doing well. And then all of a sudden, he was not. Up in the unit, the patient arrested, which is another way to say that his heart stopped. We heard them call a code blue, and when we got to the unit, he was there, essentially dead. He could not be resuscitated via the usual maneuvers, so in a final, desperate attempt to save him, the surgeon cracked the patient's chest in the hospital room. Many of you, particularly our graduates, know what I mean when I use that phrase, but for everyone else, I mean the surgeon reopened the patient's chest through the incision from the initial surgery, cutting through the skin stitches and the wires holding his ribcage together. And then once the chest was open, the surgeon put his hands into the hole and manually squeezed the patient's heart to keep the blood circulating. Then he called for the OR team to come and get the patient so we could try to fix him. I was there when this happened. I saw the hands in the patient's chest, I saw his heart not moving, and I knew the patient was dead. Not because I'm some sort of diagnostic wizard, despite my investments today, but because that's what dead looks like. I knew that we were bringing a dead patient to the OR, and we were going to work on him, and he was going to continue to be dead, and then many hours later we would give up and he would still be dead. But we did it anyway, because, I don't know. And that's the thing in medicine, sometimes you don't always know what the right thing to do is in any given moment. Maybe we did it because the patient was so young. Maybe we did it because the family asked us to, begged us to do everything, try everything, exhaust every option. Maybe we did it because the surgeon wanted to try, and what else really can you do but try at that point? I have to admit now that, in all honesty, I was a little appalled at the surgeon that night because of the clear futility of that exercise and the toll it would take. But in retrospect, I can't say that I blame him. It can be hard in the moment to know when to stop. So we went to the OR and attempted a salvage procedure, gave medications by the cartful, pumped in blood, brought in more and more equipment until the room was filled. Attempted resuscitation for hours. And the patient was still dead. In fact, after hours and hours of work, all that changed is that we finally decided to admit it. So we called the morgue, and they sent the special morgue stretcher, which is basically just a cold metal table with wheels on it. Instead of a mattress and sheets, as on our normal patient stretchers, there was just a white body bag. There was no pillow. There was no oxygen tank. There were no monitors. No clue that this was meant for a human being aside from the table's basic dimensions. Outside of a few sinister and strategically positioned holes for drainage, it was indistinguishable from the tables they used to transport equipment around the hospital. What we in the OR know was that the patient's family wanted to see him before he went to the morgue. But we could not let them see him like this. So we tried to at least make things look better. We put sheets over the body bag. We gave him a pillow. We gave him a clean blanket and covered him all the way up to his neck. We washed his face. We tried to shampoo his hair as best we could using those plastic brushes the surgeons use to scrub their hands and nails before surgery. Because the medical examiner would have to come and do a postmortem, we were actually not allowed to remove anything from the body. But as best we could, and as much as we knew how, we tried to make him look like the husband and father that they would always remember. Right before we were ready to move him to the morgue stretcher, one of the nurses brought in 2 warm bottles of saline from the ovens outside the OR. These bottles were the ones we usually use during surgery to wash out wounds before cleaning them up, and the fluid is heated so that patients don't get cold. I asked the nurse what, in this setting, the warm fluid bottles were for. For this, the nurse said, and she took the 2 bottles and put one in each of the patient's hands, which were cold and gray and mottled like fine marble. That way, she said, when the family sees him, they can hold his hands and feel that he's still warm. And that is what I learned that night. Because after medical school and residency, sometimes it's the little things that we really need to learn. The patient was still dead, but at least his hands weren't cold when his family touched them for the last time. So those are the types of things I hold on to, the small tokens and pearls I collect from my time with patients. We worked on him for 6 hours in the OR that night, employing every single life-saving medical maneuver in the book. Didn't make any difference in the outcome, and I don't remember any of it. The only things that really matter in the end are the little things. So it's the little things. It's helping your patient with arthritic fingers break her pill in half before she takes it, so it's easier for her to swallow. It's warming up your stethoscope before putting it on someone's body. It's pushing that bedside tray closer so a bedbound patient can reach their water pitcher. It's the moments between. The opportunities that arise in the midst of the big things, the things you don't learn in a classroom, but you learn from looking to others, from being still, from watching quietly, from listening. Because the practice of medicine is made up of the big things, but it's in the little things where our humanity lies. Now, this all sounds well and good now in this wonderful auditorium at this moment on the brink for you and all your ceremonial finery. But I guarantee you there will be a moment in the not too distant future, maybe in a month, when you're going to be tired, you're going to feel beat down, you're going to feel underprepared and outmatched by your surroundings. And you're going to think back on this speech and think back on what I said about the little things. And you are going to say to yourselves, what on earth was that crazy lady talking about? The little things. I don't have time for this stuff. I'm just trying to keep my head above water. And for that too, I have a piece of advice. And really, this is the last piece of advice I feel qualified to give you. And that is this. Remember who you are in this moment. You in this moment. And who is that exactly? Well, you're moments away from getting a pretty important degree. That's one thing. I promise I won't keep you from it too much longer. You're proud, as you should be. You're excited, and that you should be too. Maybe a little bit apprehensive. The world stretching before you is all at once familiar and wild, and you stand poised to take your position at the helm. Do you feel ready? If you said you did, I'd say you were either delusional or lying. That's okay. But the most important thing about you today is that you are still idealistic. I hope, at least, that even at the end of this long process, you have managed to retain the idealism that brought you here in the first place. And what did bring you here? Let's try to remember, if we can. It's a long time ago. I'm sure there are a host of different reasons, phrased in a number of different ways, but I think, and I hope that it all boils down to this: you want to make the world a better place, one patient at a time. And right now, this seems like the most obvious thing in the world, the thing that's powered you through years and years of books and finals and 4 a.m. scut rounds done on no sleep and an empty stomach. You're doing all this not for yourselves, not solely for any kind of personal glory or reward, but to help other people. Remember who you are in this moment. Older medical professionals, particularly the more cynical ones, will speak of idealism as though it's a bad thing, some sort of visible marker for naivete. But I'm going to tell you this right now: idealism is never a bad thing. And idealism seasoned with experience is maybe one of the very best characteristics any medical profession can have. Remember who you are in this moment. A young medical professional on the cusp of doing great things. Some of the great things will be large acts. The majority of them will be small. But all of them will stem from who you are in this moment, who is someone with energy, idealism, and the work ethic to make the world a better place. With all the pomp and circumstance of this particular day and all those that preceded, it seems like the concept of service would be difficult to forget. But believe me when I tell you that forgetting is the easiest thing in the world. Forgetting is passive. Holding on to your ideals is and has to continue to be an active process that you work on every day. Because there will come a night on call during residency when you're going to feel beaten down and tired and regretful of ever having gone to medical school in the first place. And right when you manage to sit down, the first time that you'll have a chance to sit down all night, the charge nurse on that floor will yell at you for sitting in her special chair. And right then, you will forget who you are in this moment. Or during a shift in the ICU, you'll have a patient who will push all your buttons, and that patient will be loud and belligerent and unappreciative and will say things that make you feel inadequate even after the hours and hours of work you've put in trying to take care of him. That patient will make you angry, unsympathetic, and when that happens, you will forget who you are in this moment. Or there will come a time down the road, a few years out, an evening after you've been working late for the 4th day in a row. This will be the one day you had any hope of getting home to see your spouse and kids before bedtime, and right as you're finishing up your notes and getting ready to hit the door, an emergency case will roll in that no one can staff but you. And that particular evening, you will forget who you are in this moment. Cynicism is a protective adaptation. It's a shell that medical professionals build around themselves after they feel they've worked too hard, seen too much, been burned too many times. It's a way for them to broadcast to their colleagues and to the world at large that they are so expert in the human condition that nothing surprises them anymore. Don't be that person. Don't be the cynic. Be for the rest of your career as you are today, someone who doesn't tuck their idealism away like an obsolete relic of their years in training, but wear it proudly on your lapel, like an ID badge, where everyone can see and know exactly who you are. Be ready for everything you think you know now to change. Be open to new experiences, but always remember who you are in this moment. Again, congratulations to all the graduates and their proud family and friends. May each of you have long, fulfilling careers filled with interesting people, challenging days, and a lifetime of surprises. The rest of us have been waiting for you, and we are so happy to finally have you join the team. Now roll up your sleeves and get in here because we've got a lot of work to do. Thank you.
Thank you, Dr. Al, for that inspiring speech. It's now my pleasure to introduce Dr. Jane Egerstadt, the Vice Chancellor for Academic Affairs, who will present the Alan Copping Excellence in Teaching Awards.
Thank you, Dr. Platt. Sarah, I would never say I want you guys all to leave. This is an awesome class, and I want to congratulate you all myself. While these commencement exercises are all about honoring our graduates, we like to take a few moments during the ceremony to pay tribute to some of their teachers. The Alan A. Copping Endowed Chair, established by the Louisiana Board of Regents, provides funding to support the Alan A. Copping Excellence in Teaching Awards at both medical campuses. This award is the most prestigious award for teaching in the biomedical sciences given by the two LSU Health Science Centers, and it is presented each year to selected individuals who, and I quote, are gifted in imparting knowledge, skills, and a lifelong quest for discovery, and who inspire the young men and women in whose capable hands will rest the health and well-being of the people of Louisiana for years to come. Because we have many outstanding faculty at the LSU Health Science Center in Shreveport, selecting a single basic science and a single clinical science recipient is a challenging task. This year's nominees continue to reflect the excellent cross-section of our teachers. The final winners are chosen by their leaders and their colleagues and their students. I'm very proud to present this year's, the 2016 awards. Along with the recognition afforded this honor, each recipient receives a lovely engraved award and a generous check from the Alan A. Copping Endowed Chair Funds. As I present this year's winners, I ask that they come to the stage to receive their awards. This first award is for excellence in teaching in the basic sciences. This year's recipient is a senior member of our faculty and an established and accomplished research scientist, which is praiseworthy in itself in these days of diminishing research funds. But this award is for teaching. It can be easily said that this year's recipient contributes to education at our Health Sciences Center at virtually every level of the process. You know, in sports, they use the term triple threat for a player that excels in 3 essential skills required for that sport. You could call this recipient a triple threat in education. And let me tell you why. In the School of Medicine, this recipient now teaches in 4 different courses, serving as the primary course director for one of them. This individual also carries a heavy teaching load in the School of Graduate Studies, teaching in 3 of the interdisciplinary courses, as well as 2 additional departmental courses, and serving as the director for 2 of those courses. And at a moment's notice, as does happen in our institution once in a while, a faculty member who is scheduled to give a set of lectures in a course cannot do it. And even worse, notifies people about that with short notice. In the recent past, this occurred in our School of Allied Health Professions and was in the field of expertise held by our recipient. And yes, with essentially no arm twisting necessary, this recipient stepped up and took on those lectures as well. So we're talking about a faculty member who provides education to students in all 3 of our schools, and in that way is a triple threat. Secondly, the term triple threat also applies in relation to levels of participation in education for this individual. As I said, this recipient directly educates our students through lectures and other activities. And at the next level of responsibility, this recipient, as I said before, serves as a course director, not only in the medical school curriculum, but also the graduate school. And at the 3rd level, this individual serves on the committee that has the primary responsibility for the entire medical school curriculum. In a second way, a triple threat. And finally, and to me, the most meaningful way, the nominations and the words of praise submitted about this recipient were submitted independently from 3 different groups: medical students, graduate students, and from the faculty, all describing the recipient's excellence, dependability, and dedication. Let me share just a few of these statements with you. From a medical student: he made it so easy to understand that I was able to answer a lot of the basic science questions on the clinical rotations in my 3rd year. You have no idea how thankful I am to have been able to learn these subjects from him. From a graduate student: he has the ability to explain difficult topics in depth and yet simplify it to be easily grasped by students. He's earned a staggering amount of respect from his students and his colleagues. From faculty and colleagues: It's clear from our students that they are happy to see him in more than one course. He is extremely well organized and thoughtful in how he organizes and directs courses. And it's not only the students, but also the faculty teaching in those courses who recognize the excellent job he does. It makes our job easier and the courses run smoother. And for me, this is one of the most reflective educators I think we have. Very few faculty members I know routinely seek out student input on their lectures or their educational activities, and so that he can use them to improve those things the next time. He's a model educator for all of us who attempt to provide medical or graduate school education. So it's my pleasure to say that the LSU Health Science Center in Shreveport's 2016 LNA Copping Excellence in Teaching Award for the Basic Sciences goes to a professor in the Department of Molecular and Cellular Physiology, Norman R. Harris, PhD. Our second award is for excellence in teaching in the clinical sciences, and the recipient cannot be described as anything but iconic. An invaluable member of our faculty for over 3 decades, it can be said that this recipient teaches us all, and teaches one of the most basic, yet seemingly underrated skills that all physicians need in abundance, no matter if they're a pediatrician, a neurosurgeon, an anesthesiologist, or in any field of medicine, and that's communication. She also takes on responsibility for teaching those topics that some would say are difficult or sort of uncomfortable to teach. Addictive disease in the first year of medical school, domestic violence and sexual abuse in the second year, ethics in the obstetrics and gynecology clerkship and to the students who participate in the Ronald George Scholars Program, and patient education in the senior year. And specifically, she is our own expert, actually a nationally recognized expert in health literacy. Because of her, our students have been learning about the ways in which poor health literacy serves as a barrier to healthcare for years, long before it became a national topic of importance as it is today. By teaching about health literacy, she teaches our students and our physicians to help their patients better understand their own health, where they can get health information, how to communicate their needs and preferences, understand the choices they have in their treatment and the consequences of choosing one over another or of choosing none. Students learn how the level of education, the culture, the economic situation of a patient, their lifestyle, and many other factors impact a patient's health literacy. Ultimately, this recipient is teaching the students and the physicians how to empower their patients to take an active role in their own health. As though this wasn't enough, she's faithfully provided students with workshops, small group lunches, and other activities that help them deal with their own health. Sessions on anxiety, time management, and my favorite, stress management, providing students with resources they can utilize to maintain their own wellness in medical school and as they progress to become practicing physicians. Nomination letters came from all levels, individual students and groups of students, one whole class of students, residents, fellows, faculty from her department and from other departments. And here are a few of their comments. She always makes lessons relevant and practical. Her teaching style is unique in that she involves patients and their perspective. What a concept. The most resonant part of her teaching is the focus on empowering patients. Medical curricula bombard students with basic science, pathology, diagnostic studies, and an assortment of other sterilized information. Occasionally, medical students need reminding that caring for patients requires as much kindness and humanity as it does clinical knowledge. She embodies the spirit of medicine that inspired all of us to pursue the profession of medicine in the first place. Another said, she is a magnificent example and role model of the passion and drive that every educator should strive for. A graduating fellow in the medicine department said, she has been instrumental in making me a physician. I know that she will be a lifelong mentor, and I also consider her a friend. I include myself when I say she is a teacher to us all and has served as a mentor for many of us, and it is my honor to call her friend. The LSU Health Science Center in Shreveport's 2016 LNA Copying Excellence in Teaching Award for the Clinical Sciences goes to a professor in the Department of Internal Medicine, Terry C. Davis, PhD.
Thank you, Dr. Egerstedt, and congratulations to the recipients. We now come to the conferring of degrees. Mr. Ray, excuse me, Mr. Ray Lassane, Chairman of the LSU Board of Supervisors, will confer the degrees. At this time, I call upon Dr. Joseph McCullough, Dean of the School of Allied Health Professions, to present the candidates for the degrees in Allied Health.
Will candidates for degrees in the School of Allied Health Professions please rise? Mr. Lassane, we have 60 graduates who have completed all the requirements for their respective degrees. I'm pleased to add my recommendation to that of the faculty of the School of Allied Health Professions and present the candidates to you for the conferring of their degrees.
Thank you, Dean McCullough. On the recommendation of the Dean and the faculty of the School of Allied Health Professions, and with the authority vested in me by the Board of Supervisors of the Louisiana State University System, I confer upon the candidates their respective degrees with all associated rights and responsibilities.
Graduates, please remain standing and receive escort to the stage by Dr. Adam Blancher and Ms. Lindsay Michelle, marshals for the Allied Health graduates. Mr. Lassane, you have conferred degrees upon these graduates. I am pleased to present them to you individually at this time to receive their diplomas. Dr. Dennis Wissing, Associate Dean for Academic Affairs, will read the graduates' names.
For the degree Bachelor of Science in Cardiopulmonary Science, John Voss Luss Eddie Ashley. Michael Travis Avery, summa cum laude. Tabitha Pauline Carter Renee. Adrian Horatio Harper. Seth Charles Harrison. Stacy Amanda Killingsworth. Lajita C. Patel. Seth Michael Sweeten. For the degree Bachelor of Science in Medical Technology, Clayton Glenn Avery. Brittany Ceres Bolden. Jack Clinton Brewer. Chelsea Noel Cheney. Brittany Curvin. Nicole Lynn Lang. Dolores Marie Rochelle. Cheryl Nicole Winters. For the degree Masters of Communication Disorders, Kelsey Michelle Bazell. Molly Louise Bozeman. Carrie Helene Carson. Diana K. Drummond. Halen Lindsay Graham. Brooklyn Dees Josie. Laura Catherine LaHaye. Mary Catherine Spring. Becca Rose Williams. For the degree Doctor of Physical Therapy, Dr. Hannah Hoffman Arsamal. Dr. Kanan K. Broussard. Dr. Hudson Ross Brown. Dr. Hunter Scott Christ. Dr. Katie Elise Como. Dr. Kelsey Audrine Crane. Dr. Derek Christopher Desjardins. Dr. Megan Catherine Flavin. Dr. Mary Elizabeth Foreman. Dr. Sydney Kate Green. Dr. Douglas Seth Greenman. Dr. Brooke Renee Hebert. Dr. Wesley Malcolm Juneau. Dr. Alexandra Marie Kennedy. Dr. Alan Charles Louvier III. Dr. Erin Nicole Madera. Dr. Hannah Lorraine McDonald. Dr. Christine Nicole Moe. Dr. Rebecca Rose Mihan. Dr. Robert Chase Patterson. Dr. Jennifer Lucky Peters. Dr. Lauren Page Peters. Dr. Donald Martin Ponzo Jr. Dr. Ariel Marie Rocca. Dr. Alexia Ray DeHara Reed. Dr. Michael Crosby Reeks. Dr. Meredith Elise Richard. Dr. Brittany Michaela Rush. Dr. Casey Reed Ryan. Dr. Eric Elizabeth Simanko. Dr. Danielle Cohen Smith. Dr. Deanna Harden Webb. Dr. Andy Lynn Williams. Dr. Sydney Morgan Wilson. Dr. Garrett Eugene Woods.
At this time, I now call upon Dr. Sandra Rohrig, Dean for the School of Graduate Studies, to present the candidates for the degrees Master of Science and Doctor of Philosophy.
Will all the degree candidates please rise? Mr. Lassane, we have 14 candidates who have completed all the requirements for their degrees from the School of Graduate Studies. I am pleased to add my recommendation to that of the faculty of the School of Graduate Studies and to present the candidates to you for the conferring of their degrees.
Accepting the recommendation of the Dean and the faculty of the School of Graduate Studies, and in consideration of their high praise concerning the scholarly achievements of these candidates, and with the authority vested in me by the Board of Supervisors of the Louisiana State University System, I confer the degrees upon these candidates.
Mr. Lesane, you have conferred the degrees upon these graduates. I am pleased to present them to you individually at this time to receive their diplomas. For the degree Master of Biomedical Sciences, we have 3 candidates who are all in absentia, so I will just read their names. Denise Mary Eric from the Department of Physiology, Kendra Megan Jones from the Department of Microbiology, and Charles Albert Stevens, also from the Department of Microbiology. For the degree Doctor of Philosophy, will the major professors and of Doctor of Philosophy graduates please come forward? For the degree Doctor of Philosophy, Dr. Mahmoud Halal Al-Kafahi from the Department of Molecular and Cellular Physiology. His major professor is Dr. Stephen Alexander, and his dissertation title is Inflammatory Cytokines Inhibit Lymphatic Muscle Contraction, Implications for Acute and Chronic Tissue Injury. Dr. Jennifer Christine Arnold from the Department of Pharmacology, Toxicology, and Neuroscience. Her major professor is Dr. Michael Salvatore, and her dissertation title is Effects of Treadmill Exercise on Nigrostrial Dopamine Regulation and Aging-Related Bradykinesia. Dr. Sankat Awate in absentia from the Department of Biochemistry and Molecular Biology. Dr. Donna K. Collins from the Department of Microbiology and Immunology. Her major professor is Dr. Andrew Yorochko. Her dissertation title is Human Cytomegalovirus Virus-Induced Cellular Signosome Promoted Viral Persistence. Dr. Elise M. Cornett from the Department of Pharmacology, Toxicology, and Neuroscience. Her major professor is Dr. Nick Getters. Her dissertation title is Behavioral and Neurochemical Effects of 96-hour methamphetamine self-administration in male and female rats, creating, developing, and characterizing a novel method of methamphetamine abuse. Dr. Samantha Sarah Dykes from the Department of Microbiology and Immunology. Her major professor is Dr. Rona Scott. Her dissertation title is Defining the Role of ADP Ribosylation Factor-like Protein 8B and Lysosome Trafficking in Tumor Cell Invasion. Dr. Elena Lee Gray, also from the Department of Microbiology and Immunology. Her major professor is Dr. Lindsay Hutt-Fletcher, but she's being hooded by Dr. Rona Scott. Her dissertation title is Microcarboxylate Transporter 1 and Isothiocyanostilbenes, Novel Molecular and Pharmacological Regulators of c-Met. Dr. Yara Mustafa in absentia from the Department of Biochemistry and Molecular Biology. Dr. Aaron Narvatel in absentia from the Department of Microbiology and Immunology. Dr. Allison Laborde Spence from the Department of Pharmacology, Toxicology, and Neuroscience. Her major professor is also Dr. Nicholas Getters. Her dissertation title is Polydrug Use, the Differential Effects of Alprazolam and Oxazepam on Methamphetamine and Cocaine-Related Behaviors. Dr. Arif Yurdagal Jr. from the Department of Cellular Biology and Anatomy. His major professor is Dr. Wayne Orr. His dissertation title is Integrin Signaling Mediates Oxidized LDL-Induced Endothelial Cell Activation and Early Atherosclerosis.
Thank you, Dr. Eric. I'm honored to call upon Dr. Ghali, Dean of the School of Medicine in Shreveport, to present the candidates for the degree Doctor of Medicine.
Y'all want to take a break for about half an hour? No? Okay. I didn't think so. Thank you. Thank you, Dr. Platt. Will the candidates for the degree Doctor of Medicine please rise?
Thank you, Dr.
Mr. Lassane. You're welcome. Mr. Lassane, the candidates have completed all the requirements for the degree Doctor of Medicine. I am pleased to add my recommendation to that of the faculty of the School of Medicine and to present the candidates to you for the conferring of the degree.
Thank you, Dr. Godwin.
You're welcome, Mr. Lassane.
On the recommendation of the Dean and the faculty of the School of Medicine in Shreveport, and with the authority vested in me by the Board of Supervisors of the Louisiana State University System, I confer upon each of you the degree Doctor of Medicine. This degree gives you certain distinctions and privileges. As you accept the degree, you must also be willing to assume the associated responsibilities that are involved. The university expects you to be diligent and steadfast in carrying out your obligation to render a high order of service to humanity.
Doctors, please be seated. Faculty marshals, please take your places. Will the first graduates please come forward? Mr. Lassane, you have conferred the degree Doctor of Medicine upon these graduates. I'm pleased to present them to you individually at this time to receive their diplomas. Dr. Mark Platt, Assistant Dean for Student Affairs, will read their names respectively.
Dr. Michael Alexander Anders. Dr. Francesca Desiree Armstrong. Dr. Tiffany Elizabeth Arnold. Dr. Matthew Douglas Io. Dr. Diana Sharon Badkube. Dr. Riddhi Sunil Bontia. Dr. Beatrice Azucena Briones. 1 minute. Dr. Brandon Robert Bruce. Dr. Elaine Holtzman Brown. Dr. Jill Turner Browning. Dr. Courtney Lee Bundrick. Dr. Eleonora Sarai Madrid Carranza. Dr. Taylor Stephen Ollier Conrad. Dr. Janice Joy Dara. Dr. Nicholas Anthony Darrensburg. Dr. Kirby Elizabeth Davis. Dr. Christopher J. Diamond. Dr. Casey Lynn Dillon. Dr. Meredith Alana Dixon. Dr. Renee Vu Do. Dr. Ryan Shane Dowling. Dr. Todd Douglas Doyle. Dr. William Patrick Ensminger. Dr. Benjamin Marcus Feibel. Dr. Scott Eric Feigenbaum. Dr. Michelle Renee Finch. Dr. Elise Marie Fontenot. Dr. Jordan Taylor Friou. Dr. Corbin Alexander Gatlin. Dr. Elizabeth Marie Gosiniak. Dr. Christopher David Graham. Dr. Adam Hayes Green. Dr. Arthur Dinkins Grimes. Dr. Sarah Bundrick Grimes. Dr. Sean Gawara. Dr. Marie Gabrielle Guterres. Dr. Erin Lynn Hafley. Dr. Stephanie Elizabeth Hankey. Dr. Dylan Don Harrell. Dr. Megan Olivia Harris. Dr. Christiana Maria Haywood. Dr. Brielle Robin Aber. Dr. Kevin Joseph Aber. Dr. Kate Louise Otard. Dr. Isabella Minon Ayub. Dr. Dylan Stephen Jason. Dr. Jamie Noel Johnson. Dr. Jerry Lamar Johnston Jr. Dr. Lee Finley Jones. Dr. Zachary Atom Charles Knott. Dr. William Richard Laborde. Dr. Jacqueline Ann LaRussa. Dr. Parker George Levine. Dr. Brandon Anthony Leggio. Dr. Gary Brennan Lum. Dr. Casey Lee Holloway Mabry. Dr. Natalie Simone Malcolm. Dr. Matthew Earl Mallis. Dr. Catherine Keller Marcel. Dr. Lauren Elizabeth McCalmont. Dr. James Nicholas McDonald. Dr. Scott Clinton McFerrin Jr. Dr. Morgan Page Merriman. Dr. Elizabeth Ames Mattison Meyer. Dr. Stephen James Miller. Dr. Katie Diane Moak. Dr. Charles Allen Moore. Dr. Naya Mussarat. Dr. Carolyn Morgan Nelson. Dr. Danielle Marie Nodeuf. Dr. Aubrey John Ogeron III. Dr. William Devin Owens. Dr. Frankie K. Pedigo. Dr. Joshua Mark Petrie. Dr. Taylor Jordan Pollander. Dr. Matthew Charles Pope. Dr. Wesley Dean Reeves Jr. Dr. Catherine Rose Rhymes. Dr. Alexandra Ballone Riggs. Dr. Jean Thomas Robichaud, Jr. Dr. Leslie Renee Robichaud. Dr. Kyle Matthew Rose. Dr. Meredith Michelle Rosenzweig. Dr. Jordan Michael Roussel. Dr. Brooke Richard Schlecht. Richard Schlecht, excuse me. Dr. Jennifer Ann Searwan. Dr. William Edward Shattuck II. Dr. Ramzi Abdullah Shalbi. Dr. Sarah Olivia Sharkey. Dr. Abhay Varun Sharma. Dr. Cameron Thomas Shaw. Dr. Crystal Janice Singleton. Dr. Megan Carol Smalley. Dr. Elena Nicole Smith. Dr. Melissa Marie Smith. Dr. Alan Levi Sticker. Dr. Lindsay Renee Tassan. Dr. Norris Bernard Thompson. Dr. Iris Alejandra Trojes Valladares. Dr. Alejandra Maria Vargas. Dr. Logan Ross Vincent. Dr. Ashley Elizabeth Vorenkamp. Dr. Ki Yan Wang. Dr. Christopher Bennett Webb. Dr. Jeffrey Adam Weissman. Dr. Laura Elizabeth Welch. Dr. Todd Rankin Wentland. Dr. Randall Glenn White, Jr. Dr. Catherine Ashe Whitty. Dr. Serena Deanne Wilkins. Dr. Sarah Marie Wilson. Dr. Dax Patrick Wolford. Dr. Pamela John C. Woods.
Don't worry about it now. I'm okay. How about the class? Thank you, thank you. We don't have much longer. Then you guys can go out and start partying and doing everything that you need to do. I have one last duty, which is to administer to the new physicians the oath of Hippocrates. Will the medical graduates please rise? One of the things that was always kind of cool, I used to believe when I was growing up, is to kind of be like Mike, be like Daddy, be like Mommy. And I know that there's a lot of y'all that have parents that are here today that are physicians, moms or dads that are physicians as well. And for anyone that is a physician in the audience, will you please stand up? All right. So what I'm going to do, thank you. So what I'm going to do to make this oath of Hippocrates a little special, I'm going to ask those physicians in the audience to repeat the oath as well. As you know, this was originally written in iconic Greek in the late 5th century BC. And the main purpose of the oath of Hippocrates was to uphold the ethical standards of the art and science of medicine. So repeat after me. I do solemnly swear by that which I hold most sacred. That I will be loyal to the profession of medicine and just and generous to its members. That I will lead my life and practice my art in uprightness and honor. That into whatever house I will enter, it shall be for the good of the sick, to the utmost of my power. That, holding myself aloof from wrong, from corruption, from the tempting of others to vice, I will exercise my art solely for the cure of my patient. And will give no drug, perform no operation for a criminal purpose, even if solicited, far less suggested. That whatsoever I shall see or hear of the lives of men which are not fitting to be spoken, I will keep inviolably secret. That whatsoever I shall see or These things I do promise. And in proportion as I am faithful to this, my oath, my happiness and good with you be ever mine.
And in proportion as I am faithful to this, my oath, my happiness and good with you be ever mine.
In the opposite, if I shall be forsworn. Congratulations, doctors. Thank you. I'm happy to be the first to welcome our 188 new MDs, PhDs, researchers, and allied health professions to the wonderful and ever-changing world of healthcare. Thank you all for coming today to join us in this fine ceremony, and a special thanks to our wonderful, articulate speaker, Dr. Michelle Au. Thank you, Dr. Au. Our Board of Supervisors and trusted friend, Mr. Ray Lassane, Dr. Russell Van Norman, and the Most Reverend Bishop Michael Duca. For a Chancellor and Dean, thank you, y'all can clap. For a Chancellor and Dean, there is no more fruitful event than graduation day. This is why we, as educators, have chosen this path, not to only care for our patients, but to also mentor and teach those who will one day take our places. Graduates, you have now become part of a very proud tradition that began with our first graduation 43 years ago, a special bond that is LSU. I'm sure our guests from the class of 1976 would agree you have much to look forward to. We know that you will represent LSU with distinction. The best advice that I can personally give you is that you need to love what you do, exceed your expectations, give back, do your best, and keep learning. Throughout your career, you will encounter many teachers, not the least of which will be the very patients you care for. Take advantage of the opportunities to be all you can be in every aspect of your life. In the words of our late first chancellor and wise mentor and friend, Dr. John McDonald, your reach should always exceed your grasp. God bless you all, and congratulations.
Thank you all for coming today. If you could please rise for the benediction and remain standing until all the participants have exited the hall.
Let us pray. O divine creator, loving God, send us forth with a joy of accomplishment and the excitement of a new beginning. Keep us safe in our travels home. Bring success to our new endeavors. May our graduates never forget or take for granted this opportunity to receive an education to pursue their chosen vocation. May they never forget or take for granted the dedication of their teachers, the work of the many individuals that keep our school open, the support of family and friends. May they in the future take their place and be the support for the next generation. Most of all, give us today a thankful heart for this essential vocation that you, the graduates, have chosen, that will serve us all in the future and is so important for our quality of life. We pray all this in the name of our God, divine physician, source of life, healer of souls, who lives forever and ever. Amen.